Knee X-ray indications will use the Ottawa knee rules in the acute phase. So these are the things which you have to consider. If the patients are falling in this line, you have to ask them to take the knee X-ray. First is that if their age is above 55 years of age, okay. Second will be the isolated patellar tendon. Whenever you touch around the patella, they will feel a pain. Or you can say without touching the patella surrounding site, you'll go and touch, they'll feel a pain. So to rule out osteophytes or osteoporosis, or you can say osteoarthritis. So next will be your tenderness at the head of the fibula. Even if there is this kind of symptoms, you have to ask them to take the knee X-ray. So inability to flex the knee above 90 degree. So you have to tell them to take X-ray. So next will be inability to bear weights after taking 4 steps of injury. There can be any soft tissue injury or ligament tear. You have to rule it out. So if they are unable to take few steps and they're complaining of pain, you have to tell them to take X-ray. And main thing, you have to consider the age above 55 of years. Okay. So this plays a very important role. Patients complaining of knee pain, you have to use the Ottawa knee rules in the acute phase. Suppose we use the age factor there, we use the pain on the fibular head or tenderness around the knee joint to rule out osteoarthritis or osteoporosis or osteophytes, or any even few steps they are taking, they are unable to bear weights. So we'll rule it out for any ligament injury they're having or soft tissue injury they're having. So you have to rule out. First thing is the age factor. Whenever they are above 55 years of age, complaining of knee pain, very severe, you can ask them to take the knee joint just to rule it out what is the thing that is causing us. If there is no structural problem in the knee, so we'll use some other approaches for treating those patients. Okay.